on the stage, I will call Roberto Priolo again to support me and support the creating a production system in days during an emergency. So Priolo, I will leave the stage to you.
Thank you very much. And hello, Angie Norman, welcome. Welcome to the LGC. It's great to have you. Let me introduce Angie. Angie is Executive Director, Lean and Finance at General Electric. I've had the pleasure of interviewing Angie for another project that they've run, incredibly interesting in finance. But today she has a story about how during the pandemic, the organization found itself in a bit of a tricky situation in that they had to stand up a whole production system very, very quickly in order to serve the needs of the community when COVID first hit. So without further ado, Angie, the stage is yours.
Thanks so much, Roberto, and it's fantastic to be here with you today. So good morning, good afternoon, and good evening to all of you. Angie Norman, I'm really delighted to be here today to share this story about the GE team during a real period of crisis and the COVID-19 pandemic. So maybe first to introduce myself, Angie Norman, operations leader with over 25 years experience in supply chain and manufacturing, really supporting and leading enterprise level transformation. And today, as executive director in GE and the senior lean leader for finance, I'm co-leading the transformation of our finance organization. So General Electric, who are we? We're an industrial leader, over 170,000 employees worldwide, and we're leading the future of flight with GE Aerospace. We're leading precision health with GE Healthcare, and we're leading the energy transition with GE Vernova. Let's jump in and share how GE Aerospace and GE Healthcare joined forces. I'm going to take you back to March 2020 to provide precision healthcare at a moment when the world needed it the most, during the global pandemic of COVID-19. So there's a key message coming through this entire story, and it really is about failing forward with PDCA, plan, do, check, adjust. So what does it take to fail forward? It means that you have the resilience and the confidence to know that failure will lead you to success. So in March 2020, as global leaders and senior medical professionals advised us to stay at home, protect the National Health Service here in the UK to save lives, GE Healthcare received the single biggest order for patient monitors in history. An order from a UK customer of 5,175 patient monitors. A patient monitor is a unit that you would rely upon when you arrive in a medical setting. It's a vital signs monitor, taking blood pressure, oxygen saturation, and key signs that medical practitioners can use to determine your vital signs and the medical healthcare precision pathway that you need given the conditions that you're presenting. As GE Healthcare received this significant order, they had to think very differently about how they would approach the production system. In the current state, patient monitors are managed on a unit basis, and they're typically assembled in the healthcare setting at the point of impact by a very talented and extensive service engineer network, not just in the UK, but globally. But this order of 5,175 patient monitors was different, significantly different in volume to anything the team had ever seen before. And therefore, a production setting was required. Not only that, but we had to make sure that we were able to apply COVID layers of safety to keep any working teams safe within the environment of COVID-19 and the rate in which that was spreading significantly across the country and throughout the world. So coincidentally, the GE Healthcare team happened to reach out for help to the GE Aerospace team. And somewhat coincidentally, the GE Aerospace team in Cheltenham in the UK had just cleared this floor space as shown in the picture at week 10. In Cheltenham at the time, we were consolidating rooftops. We were about to set up a single piece production flow line for some growing product that we were sending into the market. And the shop floor space, as you can see, was empty, ready to be set up into this new production system. But instead, in just 2 weeks, we sourced materials and equipment, and we popped up what you can see here pictured week 12, a production system. A production system capable of making one patient monitor assembly every 13 minutes. And I'm delighted to say, by week 32, 5,175 units were delivered to the customers. So let's break that down a little bit and talk about the team and what else was really at play as we set about the production system. So firstly, the government advice was stay at home, protect the National Health Service and save lives. So all of the workforce, other than essential equipment and manufacturing requirements, everybody was at home. They were at home protecting themselves and their families from this spreading pandemic, which we all now know about. So we had to reach out to our workforce and we had to ask them to raise their hand to volunteer to come and join the production system. And we had hundreds and hundreds of volunteers. We managed to use the volunteer network that was created to bring in 80 people per week to be able to stand up the production system. The production system was able of making one production unit every 13 minutes, and the lead time from unpacking equipment to a completed, assembled, validated, conforming, certified and tested unit was just 55 minutes. We had 12 different variants to manufacture, 4 different patient monitor assemblies of varying complexity. And importantly, those patient monitors had different technology on board as well. They had different configurations. And not only did we have to assemble the patient monitor itself, but we had to create an accessory kit to go with every patient monitor. And there was over 20 part numbers, depending on the configuration of the monitor, that had to be picked, sourced, selected, and packaged along with the unit, ready to go to the patient care setting. Over 150,000 part numbers had to be sourced worldwide. That's a lot of part numbers, but let's just put ourselves back to March 2020. Import and export worldwide was stopped at best. Only emergency equipment could move country to country. Healthcare equipment was given priority, but import and export was still really difficult. And let's remind ourselves that this pandemic was global. So our manufacturing plant in China was also having the same effect on their production system. And this ramp of production needs for patient monitoring was causing them problems too. And of course, at the front of all our minds was the employee safety in doing so. We were sourcing oxygen monitors. We were sourcing parts from across Europe and parts from across South America. And we had to bring all of those part numbers together at the right time in double quick order to be able to deliver these patient monitors with urgency. And that took a team of highly talented GE healthcare professionals to be able to do the job they normally do, but under this significant amount of urgency. And we popped at this production system for less than $5,500. $5,500, no capital equipment. We had to use material and equipment around us. I remember distinctly as a leader of this team trying to source some very simple tools to be able to set up the production system, screwdrivers, some simple personal protection equipment. And I remember going to the local tools suppliers and having to stand in a line outside the store. You weren't allowed into the store. You had to stand 2 meters apart and you had to wait in turn to go and procure very basic items. So if very basic items were difficult to source, then no wonder the materials required to produce these highly configurable patient monitors was also difficult. So all in all, a lead time of 55 minutes per unit, a tack time of 13 minutes per unit for us to be able to produce this total volume of 5,175 patient monitors. Let's go on to the next page here and have a look at the detail and how the team were able to be so successful. So we were comfortable with failure. In fact, I think failure was inevitable. There were so many unknowns in the work that we were doing. There were so many things that we couldn't plan for. There were so many things that ahead of time we couldn't be able to mitigate some of the risks that we may face. So we built a plan based on what we knew today. And then we set about delivering that plan. And whenever we came unstuck, we would check what we did against our plan. And if it wasn't right, we would adjust. With a problem-solving mindset from day one, the entire team solved problems on an hourly and a daily basis. So from week 10 to week 32, as you can see from the timeline at the top here, we went through setting up the production system, creating a visual workplace with layout and flow, standard work to be able to make sure we had stable operations and flexible workforce to be able to come and work to tack time, with jigs, fixtures and tooling to make sure we could manufacture on time and right first time. And then we started to ramp rate. We started to produce 100 units a week. The limiting factor here was the supply chain. It was the inability to bring the materials from around the world to be able to make one unit every 13 minutes. But you can see as we ramped up and materials became more available to us over time, we were able to really put this production system to test. And at best, producing over 600 units a week as we headed towards week 30. With that PDCA mindset, it wasn't just end to end, it was every hour of every day. And there's 4 pictures here just to give you a little bit more detail about how lean thinking was relied upon. It was actually the only thing that we knew, and probably one of the only things that we had significant confidence in. So daily and visual management, safety, quality, delivery and cost, in that order for a reason. Single piece flow, U-shaped production system. Anybody in the production system was able to detect abnormality within an instant. And then they were able to fault find and use problem-solving thinking to be able to identify the root cause and the countermeasures that we would put in place. The visual management system was essential so everybody knew what the requirements were and everybody knew whether we were on track at any moment in time. Next up, safety first, quality always. I'm delighted to say that throughout this program of execution, amidst significant ramping rates of COVID-19 across the world, we had no cases of COVID whatsoever within this production system. And why was that? Because we were rigorous and relentless about our layers of safety. Temperature checks for every single employee every day at the start of shift. Any abnormality in temperature checking and the individual was unable to work on that particular day. From layers of safety, 2 meters of distancing. So when have you ever seen a production system where there's 2 meters between every single operation within the system? We talk about MUDA, we talk about elimination of motion and elimination of transportation. And yes, in theory, that's right. But here we were making lean thinking both relatable and meaningful, and we were 2 meters apart for a reason, because it kept us safe. And having put that 2 meter distancing between us, we wanted a mechanism to be able to manage safety first and quality always. And every member of the team, the volunteers coming into the production system for 1 or 2 weeks, everybody was able to be inducted into the system quickly. Everybody understood the requirements. Everybody was able to follow safety first, quality always, and partake in the ability to deliver these patient monitors on time and in full. So we use this safety first, quality always alert, as you can see pictured. And anybody could raise one of these alerts. It would simply picture the abnormal condition and picture the correct condition. And then importantly, these would be posted visually within the production system, and the team would all sign to say, yes, I've read the detail, yes, I understand the corrective action, and yes, I can conform to that requirement going forward. And the same was true if we had any units that we shipped where we had customer escapes going. One of the reasons we had failures in the accessory units that we were creating and packaging, and those boxes would open and we had an escape where a box burst and the accessories weren't with the unit. So that was quickly, immediately reported and detected, and we were able to take the boxes and package them differently to prevent reoccurrence. Next up in the third picture here, you can see an example of one of the jigs and fixtures that we used to manufacture the roll stand assemblies. Made of wood, made overnight within a number of hours, We had a fantastic manufacturing engineer who was constantly looking for ways to make our production system both repeatable and reproducible. And the tool room, highly skilled practitioners and technicians that were able to convert that requirement into a reality for us through jigs and fixtures to make sure that we could produce a patient monitor assembly on time, right first time, and every time. And no capital equipment. You can see here pieces of wood and brackets used to make these jigs and fixtures. The great thing was that if the solution wasn't foolproof, we could go back to the tool room, we could make amends quickly, and we could get back to work and try the next version of the jig or fixture to be successful. And the reality of that ability for quick Kaizen, not expensive, not time onerous, just the ability to put to work our actions in double quick time, to be able to stay on tack time, to deliver the demand. And on the right-hand side, picture just 3 of the team members, but everybody was so important, and the team really made this such a successful program of work. You can see here the team holding up some signs. We celebrated very simply every single success that we had as a team. So every 1,000 units we would celebrate. Maybe it was pizza, maybe it was cake, something really simple, but we celebrated together this extraordinary success that the team were having. Because not only was this a huge feat, it was hard work. The 2-shift operation, a red team and a blue team, were never allowed to meet each other due to our layers of safety. We didn't want contamination to occur across shifts, but we had to form great communication mechanisms so that each shift could communicate through the daily and visual management. And our flexible operations using standard work allowed our volunteer network to come into the production system for a week or 2 weeks at a time and really cycle through and add the value that we required. And I'll come back to where I started on this page. We knew that failure was inevitable. We knew that everything we tried would not be successful, but we also knew that we could rely on PDCA, Plan, Do, Check, Adjust, to help us problem solve in real time to be able to achieve the outcome that we were striving for. So we learned many, many lessons. In fact, I could write a book or 2 on the lessons I learned as an individual and as a leader in this program. And I'm sure the team would join me in writing many volumes of those novels as well. We were prepared to fail. We were prepared to fail fast. And 3 of the lessons that I'm going to share with you today, firstly on the left-hand side here, in the face of uncertainty, rely on what you know. Rely on converting the unknowns into knowns, and PDCA has never failed. Building a plan based on what you know today, attacking that part of the plan and putting it to work, and then checking what you've done against your plan. And when you check what you've done against your plan, if you're not successful, you can adjust. And really importantly, you can adjust quickly. But the reason we were able to really rely on PDCA was because we relied on building standard work. These flexible operations required anybody to come into the production system at any point in time and have the ability to work at rate and work safely, ergonomically safely, physically safety, and make sure that the layers of COVID safety were also applied at all times. So that operational rigor, the ability to have everybody engaged in that repetitive way of working and the daily visual management allowed us to rely on PDCA and continue to work towards success. And on the right-hand side, let's come over to the performance accelerator column here and our second lesson to call out. So I was really reminded, having spent at this point over 20 years in manufacturing and supply chain operations, that true Kaizen, true change for the good, costs very, very little, because it comes from a problem-solving mindset. It comes from the desire to know that there's always an opportunity to do something better. There's always a better way, and it's our job to be able to find the better way. And the best way to put that to the test is to try. So trystorming really allowed this team to change things for the good on an hourly and a daily basis. And as we secured more and more volunteers for this production system, we continued to build that mindset with every new volunteer that came into the system. There was no, that's the way we've always done it. there was no ability to want to continue to do something that could be improved. The whole team would rally behind a better solution and come up with those ideas and put them to the test. And key in this production system, as in all ways of transformation, is about communicating. Oh, and by the way, communicate a little bit more. Because the communication patterns here were not normal. We were not stood in a production system next to each other. We were not able to have 2-shift operation communicating cross-shift pollination. We were having to find new ways of communicating to also adhere to our layers of safety. We had a newsletter solution that went out to be able to bring more volunteers into the system over time. We didn't know when we set out in week 10 how many weeks we would take to produce this volume of 5,100 patient monitors, but we knew it would take us multiple weeks, and we knew that all the time the COVID pandemic was continuing to increase in both its velocity and the velocity in which it was spreading across the world. So we had to find ways to communicate. We had to find ways to make people comfortable that we were producing these patient monitors in a safe and compliant way for their own safety. And then let's come to the middle pillar here. It's all about the team. This team won together. In fact, this team failed together all the time. But in failing together, we became winners. We became a team of GE healthcare professionals and GE aerospace professionals that were able to work together to bring our strengths to be able to deliver this outcome in just those weeks during the COVID pandemic. So one of the key things is that everybody in this team was trusted to do their part. There were key roles and responsibilities. We needed engineering to create the jigs and fixtures. We needed supply chain to procure the parts, help set up the Kanban systems to be able to manage the inventory on hand. And we needed the teams to be able to conform to the standard work to make sure that we could produce the output as required. But we also required everybody to have this problem-solving mindset. The mindset to know that tomorrow will be better because you will make it that way. And together, this team were all trusted to do their part. And in doing that, were successful in achieving this significant outcome during what were extremely trying and uncertain times. So that brings me to the end of the story. And Roberto, I think we have a few minutes here. Maybe we could have a few questions from the team on the line.
Absolutely. Thank you so much, Angie. This is really, really impressive. Wonderful story. Let me tell the audience, if you have any questions for Angie, feel free to put them in the chat. I'll get started with a question of mine. I was just wondering about trystorming. How quickly was the team able to convert those ideas into reality to test whether they would be successful?
Yeah, great question. It all depended on the type of problem we were solving, of course. But typically, in all cases, within 24 hours, we had gone from an idea to a solution, and we were starting to put it to work to test it. A couple of examples I can give you that I haven't already spoken about. We wanted some lockers to be able to put personal effects, bags and coats and personal belongings away from the production environment. Obviously, not only is that potentially a safety hazard, but we wanted to make sure that those things were not in the live production system. Mm-hmm. And we weren't able to procure any solutions, lockers or safe devices for people's personal equipment. So one of the team used the cardboard boxes that we were using for the materials and created a nest of cardboard boxes that then became the lockers to be able to position the personal equipment. That maybe took 6 hours for somebody to set up and start to create. And the team then adhered to that and put their personal equipment there. Another example is our 5S for our tooling. I talked about that story of remembering to stand outside the store waiting to order kind of screwdrivers and things in my 2-meter socially distanced queue and line. And when we brought those tools back to the production system, we wanted to be able to lay them out really simply. So we used shadow boarding, but we didn't have the capability to be able to create fancy shadow boards with foam or otherwise. And obviously this was a temporary solution, so speed was key. So one of the engineers typically got a piece of paper, drew around the item and literally colored it in with a black marker. So there's an example of we require shadow boards, and within 15 minutes we had shadow boards and we had them on every bench. So it depended on the solution. some of the more complex items like the wooden jigs and fixtures I demonstrated in one of those photos, they took a number of iterations. So maybe we had the first solution within 24 hours, and then we would go back to the tool room and they would monitor some of the wooden structure, and then we would come back to the production system and retry it. So maybe a workable solution in 24, 36 hours at best.
Wow, thank you. Something else I was wondering. Oh, hold on. We have a question from the audience. Did you use this successful story to engage a company transformation to focus more on people than in the past? Let me put it up for you.
So that's a really great question. It's all about the team. You know, it really, transformation is a team sport. So I wouldn't say we've used this to emphasize the fact that the team is important in GE's transformation, because we know that and we communicate that again. But that said, I think stories like this, particularly where you've seen almost two parts of the company that typically don't work together, rely on each other and collaborate, I think it's certainly something that I've been told is inspiring. You know, listening to this story, people have said that it's inspired them. They've realized that the boundaries that tend to exist in an organization between functions or between different teams, they're virtual boundaries, really. They're boundaries that are there because we put them there. And this is a great example to show that siloed mentality or that functional domain expertise doesn't have to belong in only that area of your organization. And actually, as we know from lean thinking, as we flow material, products, and processes through value streams, we want to eliminate those barriers at all times, because the only thing that matters is our ability to deliver what the customer requires on time and right first time. So I think, yeah, great question. We definitely are inspired by what we achieved here. And this is just one of many examples that we're lucky enough to have at General Electric. But I think it definitely is a point in time at which we can say we need to do more of this on a daily basis, because this is key to our transformation and for us to be successful with that.
Wonderful. We have 1 minute, one minute and a half, maybe. One last question. You know, with the global supply chains so challenged during especially at the beginning of the pandemic, how did you build the flexibility in the production system that you set up in order to be able to manage all of that fluctuation?
Yeah, I think firstly, lean thinking relied on the calculations of takt time, how many employees we would require. And then we created the initial layout actually had 80 workbenches. So because we didn't, again, know how to keep people safe and segregate people at that time, we were just learning what COVID layers of safety meant to us. So we had production available space was number one. Then second point, having had that space available, we created that volunteer network to be able to make sure we had enough people to be able to pull into the system to keep it flowing. And then we relied on standard work. So making sure that the standard work was able to be followed within the takt time so that we could produce the units. What we quickly found due to the supply chain was the fact that we had to produce more units. So we actually had to ramp up to a takt time of only 8.5 minutes by the end of the production system to meet the requirement. So the flexible operations were really born about our ability to manage and revise and improve that standard work.
That's great. Thank you so much, Angie. This has been fantastic. Thank you for joining us at the Lean Global Connection. Great work. And we look forward to seeing you again soon. Thank you so much.
That's great. Thanks for having me. Cheers, Roberto. Bye-bye.
Bye.
Thank you. Thank you, Roberto.